Hello everyone, Sawadee Krab. Welcome to the IIC Thailand chapter's webinar on data privacy and COVID-19. My name is Prapanpong Kamon, or you can call me Ed. I am the director of the IIC Thailand chapter and also Associate Dean of the School of Law, University of the Thai Chamber of Commerce. And also I will be the moderator for today's session. In every part of the world, we see countries implementing tools to help manage the crisis of pandemics. We use tools like contact tracing apps and location tracking applications to alert people of the potential threats from the COVID-19 cases. These tools, as you know, of course, require people to give in their personal data. But the really important question is, how can we use these tools in a way that is less privacy intrusive in order to gain people's trust so that they can get into the system more and use the tools to benefit themselves and society? And that's what we are going to be discussing today. So I would like now to introduce you to our speakers for today in the order that you're going to be seeing them in the presentation. Okay, first we have Raymond Enrique Riboro. He is the Privacy Commissioner for the National Privacy Commission of the Philippines. And he's also the chair of the Global Privacy Assembly COVID-19 Task Force. So really, he would be a perfect person to be the first speaker to give the overview look at the issue. Next, we have Thitirat Tipsamrit-Kun. She is teaching law at Faculty of Law, Thammasat University, Thailand. She's done several works in the areas of data privacy in Thailand, and she also serves as legal expert in the Personal Data Protection Committee of Thailand. And from Singapore, our next speaker, we have Kevin Shepperson. Kevin is the CEO at Straits Interactive Singapore. He's also the author of the international acclaimed book, 99 Privacy Breaches. Our next speaker, Edwin Concepcion. He's the head of the Past Excellence and Support of the ASEAN region, and also from Straits Interactive Singapore. He's involved in several trainings and workshops in the area of data privacy, also in the region. But as you see that many speakers, all speakers that we have today come from the ASEAN region, our topic is by no means confined within the region, because the topic is really a widespread topic and can be international in the reception. So each speaker will first give a 10 to 15 minutes presentation. And after everybody finishes presenting, I will pose some of the questions on my behalf to the speakers. Okay, and without further ado, I think it's time that we give the floor to our first speaker, Commissioner Libero.
Thank you, Dr. Ed, and thank you for inviting me. I'd like to thank the International Institute of Communications here in Thailand for organizing this very worthwhile and meaningful event. As you mentioned, we are gripped today by this very unfamiliar pandemic. And it's unfamiliar, but the experiences of data protection authorities all over the world are becoming really familiar to each jurisdiction. And this is indeed very timely. And I'm just viewing myself in this telecon, and it seemed to be a halo behind me. No, I'm not a saint. This is actually the logo of the National Privacy Commission, of which I represent. But as you mentioned, I also represent the Global Privacy Assembly, who had recently organized the GPA COVID-19 task force in response to this global pandemic. So I will be given the opportunity today to present something that has not really been discussed openly, because I'm presenting to you the result of a survey of a study we concluded just recently on the concerns of DPA or data protection authorities all over the world. So your audience today, Dr. L, will get actually a first pick into the results of this very important survey that we did. So let me share my screen now. And let me begin. Can you see my slide now, Dr. Ed?
Yes, I can see your slide perfectly.
All right, thank you. Thank you. Really, the GPA Executive Committee recognizes the privacy and data protection challenges posed in the context of the COVID-19 pandemic, and DPAs have been consulted and are continuously working together with relevant government agencies and organizations within the respective jurisdictions to help respond to this health crisis. And given that DPAs are facing similar issues and challenges, in April of this year, the Executive Committee met in an extraordinary session to agree to consolidate efforts and maximize the voice and expertise of the different data protection authorities all over the world, and we organized the GPA COVID-19 Task Force. And I will show you the 5 deliverables we have agreed in organizing this task force. The duration of the program will be until October. And as you can see, we have identified 5 very important deliverables. And first is really identifying, examining the most pressing issues across the globe with regard to COVID-19 and the response of DPAs and jurisdictions and even nations. Collect evidence and produce case studies of good practices that can be shared. Reach out to our external stakeholders and develop capacity building activities for everyone, for everybody. And lastly, to prepare for resolution on COVID-19, which will be discussed in the upcoming virtual session of the annual Global Privacy Assembly session in October to be hosted by Mexico. So really, what we're trying to address here is to come with practical ways in which COVID-19 can be addressed and responded to by data protection authorities all over the world. And really tapping into the network of DPAs to be able to share knowledge and create knowledge in pursuit of coming up with best practices. As you can see, there are strategic issues that we have zeroed in. And number one and foremost would be the role of the data protection authorities as enablers and protectors in the midst of the pandemic. I think it's very important that we emphasize that the role of DPAs in this pandemic is very critical. Not only is this pandemic unfamiliar, but it's also a historic conjuncture. And we must consider this pandemic as a historic conjuncture where, our performance during this period, I may say, call it performance, would actually determine also, would have a bearing on the future of data protection and privacy all over the globe. Second is really the global COVID response on tracing, testing, and treatment. COVID patients. I understand that the issues are actually revolving around this, and in fact, even the emphasis of the subject matter today, specifically on contact tracing, is actually foremost in the minds of many data protection authorities. And lastly, how would DPAs respond to the new normal? Right. So, what are the emerging privacy issues that we can identify? What are the new normal best practices that everyone can get used to? How do we use data in this new milieu, in this new normal? And how do we protect the most vulnerable segments of our population in this new atmosphere that we're all working in? And how do we continue building the capacity? And I really appreciate this effort by the IIC. You've started the ball rolling in this regard, in this part, and that's why we have also been vigorously promoting networks and reaching out to our other stakeholders all over the globe. As you can see, let me now present to you the results of the pressing issues that have been identified globally. And so what we did as part of the first deliverable is to conduct an international survey. And this is actually the result from 54 respondents all over the globe, right? So let me, and based on this, and we just recently analyzed the data that has come to us. And number one on the list Okay, if I may call this list as a list of pressing issues based on, well, related to COVID-19, is contact tracing and location tracking. So you can see here that the data sharing of health data with health ministries and institutions also is a concern. That sharing of health data with law enforcement agencies is a concern. Data sharing of health data by charities, organization groups offering support and assistance, handling of employee data in work from home, return to work situations, handling of children, students' data associated with the use of e-learning and online schooling, social discrimination and public embarrassment. I can see some of you nodding there, right? Because again, these issues resonate. It only means one thing, that all these issues resonate or are being felt in all our jurisdictions. Again, this is the result of a survey that was held globally, that was collected globally with the very diverse international respondents. So having said that, again, if you look at it, 82% thought that contact tracing is a very real and really important issue. That's why there's no wonder, Dr. Ed, that you really zeroed in on this particular matter. But basically, again, on how data is being shared, and now, at number 5, you can now can see the, the anxiety that some of our that the global citizens are having with regard to this new arrangement, employee data in work, on return to home situation, work from home arrangement that is being implemented all over the globe. It's actually, again, raising issues that are very familiar to all our citizens. And students' data, and again, that are coming from the most vulnerable sectors. And social discrimination. Later, somebody will also be, I think, reporting on some of the events here in the Philippines, or rather in our region, in the Southeast Asia region, including the Philippines, where we also have our own fair share of these events and occurrences in the recent past. Okay, so on contact tracing, let me just zero in now on contact tracing and location tracking. And really, what are the strategic issues that are being raised? Just to show you some of the numbers. Across the 54 respondents or jurisdictions that replied to our survey, they said that, more than 40% said that in their jurisdictions, contact tracing applications, so the downloading or the use of contact tracing applications, is voluntary and not mandatory. 20+% of those who responded says that they are in the process of ramping up or developing or about to launch contact tracing applications of their own. Again, so the use of digital solutions in response to COVID-19. And around, less than 5%, almost 5% here, says that contact tracing applications, meaning citizens are mandated to or required to download contact tracing apps in their phones, right? So what are the issues that are being encountered with regard to these contact tracing apps? Well, Bluetooth is actually the most commonly used technologies, right? Issue records, the use of, users' location, and the people with whom they interact with. And most of these applications are used voluntarily, at least that's what the statistics show. But the common privacy issues encountered by each jurisdictions would be in the areas of proportionality of the data being collected, the transparency, right? The declaration of the purpose on why and how this contact tracing will actually work, the legal basis, which would support the use of contact tracing, the deployment of contact tracing. As I showed earlier, that's about a fair, just a small number, but they are mandating it. So there's got to be a legal basis for that. And the issue of where the data is being stored. I think that this is central to who's actually controlling the personal data that are being collected by these contact tracing applications. The retention is also the information on how long that they will use or share and contain this data. And of course, I guess the overall anxiety of the prevention of misuse of data and using it for other purposes, technical security, and privacy by design issues. So there are in fact, I failed to mention, so there are the issues that have been identified by the task force, by the COVID-19, the GPA COVID-19 task force, is really now how to promote privacy by design and proportionality and transparency in the design and the build of these contact tracing applications, the audit framework for contact tracing, who really does the oversight when a jurisdiction or when a government launches its contact tracing or digital solutions. The anonymization and security risks, they have to be spelled out and built in decommissioning strategies, all right? So really, there's really a compulsion to collect a lot of data these days, and we have to come up with the concrete strategy on how do we decommission this once it gets out. How do we actually decommission these applications that have been launched? And lastly, the question of decentralized versus centralized data solutions. Again, this is being raised in view of the fact that two of the largest technology companies, I know everyone here is well aware of, Apple and Google, have come up with a watershed deal to come up with a exposure notification application. So probably, Dr. Ed, I might ask you later, is that going to be implemented also in Thailand? No? But really, the idea here is that this application, this exposure notification API, this is being awarded now all over the globe, would be interoperable, meaning the benefit or the promise is that everyone will be able to download this. So wherever they are, even if they cross borders, then there could be some form of contact tracing that can be had. So other issues stated with regard to COVID-19 contact tracing applications will be the cybersecurity issues, scams, including robocalls, government imposters, and identity theft. And what is so surprising here is that we've been getting reports that global, these are global reports now coming in, and we've been monitoring news about sorry, my dog is acting up. But really global news now about excesses or, again, nefarious activities coming out of contact tracing. I mean, efforts of government being undermined by criminals. All right, and this has also been raised, the challenges with the shift to virtual care in the health sector because of telehealth. Again, the COVID-19 has really opened up again, a lot of readjustments and on the way people are doing or conducting their business, and that includes the health industry in general. So the challenge of physical face-to-face doctor-patient consultation is now being done through telehealth, and again, this means that a lot of digital platforms are being launched to conduct telemedicine. So cases concerning disclosure of patients' personal data in aggregated form in connection with fighting against COVID. So I think what is being apparent now is that there is really a rush, again, in trying to contain and fight COVID-19, which should be in everyone's mind. There's also a corollary effort, a parallel effort to collect a lot of personal data in this pursuit, right? So if you are a data protection authority, you are really, we are also in a way, we are also frontliners in this fight against COVID-19. The use of new technologies is also, again, we've been getting a lot of reports about technologies and how these are being used and the transfer and sharing of personal data. So this is, again, I'm showing this to you because this is what we have gathered from the global survey that we did. So this is something really hot off the press, so to speak. So let me just introduce to you some of the work that we're doing in the GPA COVID-19 task force. We have organized, the task force itself is, we have 34 members, is composed of 34 members and observers of the Global Privacy Assembly. And we have divided the work into two subgroups. The first will be subgroup is on emerging privacy issues. Second is on subgroup on capacity building activities. The first subgroup's task is to come up again with a compendium of all the experiences of all the members of observers and observers of the GPA. And I'd like to, if Andrea Jelinek is already around, but really the experiences of the jurisdictions in Europe, for one, would really be invaluable also well, as we come up with a compendium of best practices that can be shared here today at present. But really, in the future, this would really be a treasure trove of knowledge that can be created after October, when we conclude this project. And the second subgroup in capacity building activities and developments, again, reaching out. We've been launching several webinars ourselves. And let me just show you some of the how the two subgroups have been divided. The first is led by the PCPD of Hong Kong, and the second subgroup on capacity building led by the Dubai International Financial Center. And we're also awaiting Mexico's confirmation of their leadership in the second subgroup. And these are the activities this is a shameless plug again for the GPA task force. Hope you don't mind, Dr. Ed. But right tomorrow we have a task force initiated activity. This will be, as I mentioned, the DPA's authorities as enablers and protectors, testing, tracking, and treating COVID-19. And on August 6th, we also have. So I just want to show to you the response that we've also been getting from the other organizations all over the globe. And, we still have time. The IIC, probably we can come up with our own collaboration too with the GPA CTF on this. So I'd like to thank you all again for listening in. I hope I gave you a glimpse of what's going on and how everyone is responding to COVID-19. Thank you.
Thank you very much, Commissioner Libero, for the fascinating presentation. I'll keep some questions for you in the question and answer session in the end. But
thank you, Dr.
Yeah. Okay, so moving on to our next speaker, Professor Titi Rat. Would you like to share your slide and present the views on Thailand situation, please?
Okay, so thank you very much for the International Institute of Communications and also the Thailand chapter, and thank Ed for inviting me. And yeah, I'm quite interested in many issues raised by Commissioner Libero already, but now please allow me to show you some issues in Thailand. So I prepared some slides and I hope this will be helpful. So I think for the measures related to data privacy taken by Thai governments, I divided them into 4 categories. And the first 2 will be concerning general measures and also for the domestic travelers. And so the general measures are enforced, not really enforced because not all of them are compulsory, but it's used for everyone, every citizen, and also foreigners who live in Thailand. And the first thing that you can see if you come to Thailand this time is collection of names and phone numbers before entering into public venues, which means buildings, shops, restaurants, department stores, banks, and many other places. So every time you go out of home and entering into some place, especially those places that you will stay for more than half an hour, or even in some convenience stores, they do collect these names and phone numbers as well. So this is almost compulsory. I think we can say it's compulsory, but the options of collecting can be done through a very analog way, is by writing down your names and phone numbers. And also we have the check-in, the technology to do this, which is called Thai Chana. It's sponsored by the government and encouraged by the government for everyone to use. So I put it voluntary because this is not compulsory, but many shops, many restaurants feel compulsory to use this. So I'll show you how it looked like. So this one is Thai Chana. So this is, I'm not quite sure, do you see the mouse symbol when I move? Yeah, okay. So this is the logo of this app. It is not actually app, it is web app. So you don't need to download any application on your mobile phone, but you can just scan the QR code and then enter your mobile number. So then that will be called check-in. And you actually have to check out, but most people do not check out because they just forget once you get in the restaurant or the shop, and then when you get out, most of people do not check out. So that is some problem in the system. But anyway, it is web app, so you don't really need to download. And we also have another alternative, which is called Mo Chana. So it sounds very similar to each other, but Thai mean Thai and Mo mean doctor. So the second one, this Mo Chana, is initiated by doctors, not actually doctor, by independent developers to help doctors, because there were some concerns in the very beginning of the pandemic around March that doctors and medical personnel are in threat, in very dangerous situation, because people are not very careful about how to protect themselves, or do not really tell the truth to the doctors that where they were, or were they in dangerous situation. So this application were launched by independent developers to help the doctor at hospital to see the risk. Okay, so I would like to use this table to explain the difference between these two apps. Okay, so as I said before, Thai Chana is supported by the government, and it is almost encouraged by the government to be used, and it is used widely. So the number of users is 37 millions, which is half of populations. I would say almost half of population in Thailand. But this is total number. So it doesn't mean that the number of people, of users in this month are 37. So it might mean 37 millions in the very first month that was launched, but not in this month. We don't really know the active user numbers. Okay, and for Mo Chana, it is 270,000, which is not bad. And the way that these two applications, these two tools work a little bit different. First of all, for registration, Thai Chana only require a mobile phone number. And if you use application, you have to verify the OTP, one-time password, which is sent through mobile SMS. But for Mo Chana, you need to register with face photo. No mobile phone number is required, but you have to assess yourself through some questionnaires like this, and then the app will tell you the level of risk that you have. And usually, if you have low risk, then you will have this the green QR code on your application. So that's how it works. And also, the data controller here is also different. Thai Chana is controlled by Department of Disease Control. But for Mo Chana, it is Digital Government Agency, DGA. I put question mark here because it was not very clear at the beginning, but I just checked the privacy policy again last night, so it was quite clear that it is Digital Government Agency that is the data controller now. And the developer is also different. For Thai Chana, it is Krung Thai Bank. So some of you might feel a little bit, this might be a little bit strange because it is commercial bank that, of course, and you know that bank is also working with personal data in many other contexts. One reason, I guess, that's why Krung Thai Bank is in charge of developing this app, is because they have the expertise in developing this kind of check-in and check-out application, which is used for many other commercial ways. Okay, for Moshana, it is independent developers called Code for Public Group. And the tracing technology which is that is used is also different. For Thai China, it only needs QR code check-in and check-out. They do not track the other signals of the phone apart from check-in and check-out, voluntary. And for Moshana, they use GPS, Bluetooth, and plus QR code check-in, but QR code check-in is not emphasized. So GPS and Bluetooth are the main technology used in Moshana. And with this, it is claimed that the information will be encrypted before sent to the data center, which is controlled by the Digital Government Agency, and they do not require any other personal data relating to this. Okay, and for the alert, so the two app claims that once there are any risk for the place that the users were, these two applications will send the user some alert SMS. And there were one case this month, actually at Rayong province in the eastern part of Thailand. And it was reported that Thai China alerted almost 400 persons for this. And for Moshana, 10 persons. But I think this is the number is due to the number of users, which are quite different. For data retention, there are some difference as well. For Thai China, they says 60 days in the back-end system after the collection. So it was reported that yesterday was the first day that Thai China started to delete some data. So the data that they collected in the first day of launching the app is now deleted from the system. And for Moshana, it is it says 30 days after the end of COVID-19 pandemic or the end of the Emergency Act. So I actually just forgot to mention that in Thailand, we are now under the Public Emergency Act that grant more power for the government. And that includes the use of personal data in dealing with pandemic as well. For data storage, which the Commissioner Liberal also mentioned as well, for Thai China, it is stored at KBTG, which is under the bank, under the Krung Thai Bank. And for Moshana, it's stored in Amazon Cloud, controlled by the Digital Government Agency. For privacy policy, this one is quite interesting, in my opinion. Moshana has its own privacy policy, but Thai China used the same privacy policy as with the other products of Krung Thai Bank, which is a little bit strange for me, that the purpose of Thai China itself is not the same with the purpose of other products or other users provided by the bank. So it might not be very normal to share the privacy policy between the products like this. Okay, so this is the summary about the contact tracing application. But there are also, of course, some body temperature check at most of the places that we go in Bangkok and other places in Thailand. One thing that you might be interested is that I noticed the use of automatic thermal scan with also face detection, and many companies are right now advertising about the possibility of collecting this data and combining the function of CCTV with this kind of thermal scan, which will of course raise the issue of privacy in the future. I'm sorry, I have to go back to the slides again. Okay, and also the other measures that is enforced for domestic travelers in the country. Of course, compulsory quarantine at home or designated locations. It depends on provincial orders, and these people are monitored by villages public health volunteers, which is quite effective system. But of course, these volunteers, they are not governmental officer, and they are not really trained to comply with data protection standard. So we heard a lot of cases where these volunteers share the information of infected persons or risk those persons who were in the risk area with the others via chat application, and those information were forwarded again and again to the others, and some led to privacy issues as well. Okay, so, and of course, for this impact of contact tracing app, apart from the issues that Commissioner Liberal mentioned before, the accuracy of the technology, the discrimination at the point of services that might happen if you refuse to use those applications or refuse to give your personal information. Also, the frequency of data sharing to the other organization, the period of data retention are also problems. And there were some concerns about SMS sent to people phones, and those happen to Apple phone, to iPhone via iMessage after using the app. But for these, it was clear that this is not caused by the using the app contact tracing application, but this is some different issue, marketing plan done by gambling website from other countries. But it is because people were worried about privacy issues, so that's why they kind of connecting two issues. One is like scam through SMS with the use of contact tracing app. And of course, there was some problem of phishing links to lure people to download dangerous apps or go to the dangerous links as well. And that led to reactions in the society that many refuse to use the application, refuse to scan or check in and check out, or pretend to scan. So this is something that you can see normally in Thailand right now. Many people still comply, but many people do not want to comply with the encouraged method of contact tracing. But good thing, maybe we can say good thing about this is this make many people ask more questions about privacy in other contexts too. So in this time, people in Thailand, I would say that in last year, you will not hear a lot of questions about privacy as much as this time of the year. So this might be the positive side of this. I actually have some other example for the other issues which is not connected to contact tracing app, but I think I am kind of go over the time right now. Should I keep this for the next round, Ed?
Yes, I believe so, yes. Okay, thank you very much, Professor Thitirat, for giving the overall picture of the Thailand situations. And I think maybe we will have a little bit of time to discuss the other part of your presentation also, but we keep it at the end in the question and answer session. So moving on to our next speaker, we have Kevin from Stress Interactive Singapore. Kevin, the floor is yours.
All right. Hello, everyone. Thanks for the invitation. I'd like to thank the International Institute of Communication and Dr. Prapampong in terms of introducing to me. I'll be talking about what's happening in Singapore and the impact of privacy and how we use the applications. Before we go on, I would like everyone to see the numbers in Singapore. We thought we had it under control. Now, Singapore has got a population of 5.5 million or so, but you take a look, in April, it spiked up because what happened was we have about 300 223,000 low-wage migrant workers. They stay in the dormitories, and in each compartment, we have about 50 to 100 people living together. One of them got infected. So what Singapore did was we have two kinds of screening. One is called proactive screening. So they comb every single dormitory. So their intent is to do contact tracing and do the testing for 323,000 migrant workers. So every day in Singapore, we have an average of 100 to 300 cases. And as you can see, till date, we got 48,000 cases in Singapore, the third highest in ASEAN. But the community cases, which is Singapore and the PRs, permanent residents, is only 10 per day. So this is the challenge that we had. So let me now take you through what's done in Singapore. We have a national task force. And what this task force does is it coordinates the national effort, and it looks at the community response and also looks at working with the international community. Now, what you see here are different players in the whole contact tracing initiative. So we got two ministers, the health minister and the national development minister. And the entire contact tracing is actually done by the Ministry of Health. So when you are diagnosed with COVID-19, what happens is you're then interviewed by the hospital, and they will map out your history of movement in the last 2 weeks. And they work together with the Ministry of Health. They got a contact tracing team. And from there, they will work with the airlines and transportation companies. And the important part is to contact the next of kin to fill up the gaps in the information. And more importantly, identify the close contact at risk of infection. And as all of you know, this would be your family members, your close colleagues, your travel companions, or those who spend at least 30 minutes, right? So if you are suspected to have it, then you go to a quarantine center. Now, here's where the problem is, right? Not every single contact person can be traced. So when that happens, they then work together with the police, that's where they do analytics. And unlike other countries where they look at credit card transactions, in Singapore, we don't do that. We just comb through the CCTV cameras, right? And that's how we find the potential folks who got into contact with basically the suspected cases. CERTIS is a security guard. So they will then issue you, if you have a suspected case, you are asked to stay at home for 2 weeks, or you go to a quarantine center that can hold up to 20,000 people here. So notice no other personal information is actually collected, right? And the SCDF is our Singapore Civil Defence Force. They are the ones that will respond to any cases that comes from the clinics or any emergency cases. So it's a combined effort with all the players. But I want to focus on GovTech, which is today's topic. So GovTech has actually introduced two initiatives. One is a safe entry, similar to what Professor Taitarat was talking about. It's a web app. It's a check-in and check-out app. And another one called Trace Together. This is the one that uses Bluetooth. I will explain, right? The whole objective here is to have a detailed movement of your history, the places you visited, the recent activity and close contacts. And as you can guess, not every one of us will remember where we actually went to, right? So in Singapore, wherever you go to, whichever venue you check in or check out, is compulsory. You will have to check in. You can either do so with the Safe Entry app in terms of for the location tracking. So you go in there, and let me explain how this works. So one part is you just use your phone, right? And use your camera as what was mentioned earlier. You scan the code and you check in. They only collect your national ID, and that's basically it, right? So that, as you can see, when you go to the venue, there's a QR code similar to the Thai China app. And when you scan it, then you will log in. So this data goes only to the government database, right? The Ministry of Health, and all those information are locked in there. So this is one method where this is solely web app. use your camera, you log in. The other one, which you can see has got lots of privacy issues. We see many cases where if you're not using your app, then you check in, you record them manually. But as you can see from this photo, the names are all exposed. So this is one big issue here. So you are checking in, checking out, and at the same time, you also check your temperature. Okay, so this is the first part where they track the location. You log in manually, either through your phone or through this manual method. The other method is the trace together one, and this is the one that you can download voluntarily speaking. Anyone can download it, and it only collects your mobile number, your name, and your IC, nothing else, no photos whatsoever. So this is the app that wherever you go, right, it then uses Bluetooth, and I'll explain this in a few minutes time, because if you take a look, when you check into the venues, you might take a bus, you might walk past a busy street. All those, there are no evidence of who you come into contact. So what the Trace Together app does and how it works is you download the app, you register your mobile number, similar to the Mochana app, but here it assigns a randomized user ID. So you're not identifiable. Everything is encrypted. So now you know that if you come into contact with another Trace Together user, then your phone will have recorded all of these temporary IDs, which are then encrypted. And as I mentioned, it uses Bluetooth. So yesterday I checked my phone, I came into contact with 500 people, right? So they also use the Trace Together app, and I can only see that there were 525 other users. So the app is then kept, the information is kept in the phone. Now this is important because any data that the Trace Together collects is all stored in the phone. It's never sent to the authorities, right? That only happens if you, the user, you fall sick. It's only then when you fall sick, remember I said you go to the hospital? This is where you will be asked to, if you have the app, the Trace Together app, this is where you will upload the data from your phone. So whoever you came into contact with other Trace Together users, they will send you a PIN, and then you upload all of that data. So all that encrypted data would then be decrypted by MOH, which stands for Ministry of Health. And that's where they will then see the user ID and the phone numbers, and then contact all those folks here. We have the usual seeking of consent and so forth. And that information is made available for the last 21 days. Now, in Singapore's case, the Privacy Commission was actually involved, and they did privacy by design. So the app was not developed separately. So the commission actually got involved, and they were very particular in privacy by design. So if you read the privacy notice as well as the help documentation, they were very proactive. They knew that a lot of people were asking questions. Hey, whenever I go, is that information stored locally? So they reminded everyone here. So the privacy statement states very clearly that only limited data is being stored, right? No GPS information is stored. Only the IDs that were collected via the Bluetooth signals. So it's in the privacy notice, and it's again reinforced in the documentation. So what is the impact on privacy? So even though we have a law in Singapore, it doesn't cover the government, because the government themselves have got their own rules, which is said to be more stricter than our Personal Data Protection Act. If you go through all the standard consent, transparency for notice, the retention limits, right, the data being encrypted, all of these are nicely covered. So we scan everything. We even tried to look at hacked versions. We know the data only went to the Ministry of Health. But here's the problem. They recently updated the Trace Together, which had the lowest permissions of all contact tracing apps in the ASEAN region. But someone decided to integrate the web app with the Trace Together function. So now permissions, what the app does, it assesses the video camera. And my question is that necessary? Because if you walk into any location, you just take out your phone, you scan the QR code. Why do you need to integrate them in the Trace Together app? So that's my question, right? Because it then invites more concerns, as in, hey, now the phone accesses the GPS, it accesses the camera and so forth. So questions will be asked. Before I end off, it's important for me to point out that under Singapore's Infectious Disease Act, it is compulsory. Everyone has to declare, right, their whereabouts should they be infected. So the Trace Together, the combination of Trace Together and the Safe Entry, they jog back your memory, okay? Now I just want to end off by showing you something very interesting. Singapore has gone one step further. They are actually introducing a Trace Together token. And this token is actually targeted at the elderly folks because not everyone has got a mobile phone or cell phone. So this does exactly what Trace Together, how it operates. It uses Bluetooth and is kept for 25 days. And if you happen to be tested positive, then you hand over the tag to the authorities. And that's where they would then decrypt all the other Trace Together tags or apps. When you come across with other people, those will be then revealed and they will contact accordingly, right? So you don't have to remember, everything is supposed to be there. But here's the problem. Can it be turned off? So the app, this tag has not been implemented yet, but we are now getting a lot of privacy concerns. It's still in the early stage. So if it's not turned off, because in Trace Together, you can off the app, right? And not make it run in the background. But here's the question that is now being backed. We are all begging, we are now asking this question, is this forever there? So we don't know and we have not validated it yet. So with that, I will end off by sharing the fact that we have the location tracker and the contact tracing app, and we have gone one step further to include the tagging as well. So with that, folks, I hope you have a good overview of what is being done in Singapore. Let me stop sharing and return the session back to Dr. Ed.
Thank you very much, Kevin. Again, we keep questions to the very end, and we are going to move on to Edwin. So Edwin, the floor is yours.
Okay, thank you very much, Professor Ed. Let me share my screen. All right, so mabuhay to everyone in the session today. I hope to give you some glimpse of what is happening with regards to the contact tracing in the Philippines insofar as COVID-19 is concerned. All right, just to maybe put into context the ability of the mobile devices, especially in the Philippines context or setting. Yeah, so out of our almost 109 million population, we have a mobile phone connections of about 173. So that means almost probably about 60 to 70% of Filipinos are actually using 2 mobile devices. Yeah. In terms of internet usage, we have about 97% penetration rate. So about 70 million of Filipinos are actually using their mobile devices to connect to the internet. Right. In the Philippines, a Bayanihan Act law, or what we call the Republic Act 11469, was passed as an emergency act to address the pandemic at the end of March. And then a national action plan was laid out also by the current administration, involving all the government agencies from the economic side to including the local government units and even the health department. Yeah. And then a national task force against COVID-19 was also created to address all the issues that are being experienced by the Filipinos, especially in terms of the economy. And then an interagency task force on emerging infectious diseases was also activated. Just to point out that this there's already an executive order creating this interagency task force even before the pandemic. That was passed in 2014. So this agency was activated by the national government, headed by the Department of Health, right? Similar to Singapore, the Philippines already has Republic Act 11332, which mandates, all department agencies, local government units, barangay units or districts, private companies, non-profit organizations, including all health institutions, to report infectious diseases. So this law was also activated by the national government and required everybody to report any issues with regards to their health insofar as COVID-19 is concerned. Yeah, so the IATF, or the Interagency Task Force for Infectious Diseases, actually came up, signed a memorandum of agreement with a private developer for a contact tracing app. This was signed in April of 2020 through a resolution by the agency task force, which includes cybersecurity, data privacy, and confidentiality laws into the agreement. So this was developed by a private company and was introduced to be the national contact tracing app in the Philippines. It's called the Stay Safe. All right, so what the Stay Safe does, there are two versions available, web-based that you can do from your desktops and also from your mobile devices. Yeah, so you can download the app through the app stores. It's a community-driven contact tracing, as what they would call it. What it does, it has 4 basic functions. It's a health declaration, voluntary health declaration by the individual, where you can upload your own health status. It also has require you to activate your GPS and Bluetooth for contact tracing. And then, of course, they use it also for a social distancing system, wherein you can see a map on how far or how close or your proximity to other users of the app. And then, of course, it also has a QR code, which functions like your health pass. So you can use this QR code to go to private establishments and show them that what your health declaration is. Yeah. So there were also other apps that are available in the Philippines. All are privately developed by private organizations. There's NCOF, WeTraceClear, and RC143. Some of the issues that are being experienced with regards to these contact tracing apps is because there are just too many contact tracing apps available. Although the Interagency Task Force has adopted and signed a memorandum of agreement with Stay Safe as the official contact tracing app, this did not stop the other private organizations, hospitals. The RC143 was actually developed by Red Cross Philippines in coordination with Red Cross International. So the contact tracing was quite fragmented because of so many contact tracing apps available. So what were the impacts of the contact tracing apps insofar as data privacy? So one, because the Stay Safe, wherein the individual can do their own voluntary self-declaration of their own health status. So it was very prone for misuse. There was no process on how to check the accuracy of the health declaration by the individual. And of course, the behavioral tracking as well, so because you have to turn on your GPS and of course your Bluetooth. So there were also a lot of malicious threats insofar as the app is concerned. There are a lot of disinformation that's happening in the social media over Facebook, Twitter, and Instagram. And then of course, the issues about identity theft experienced by some individuals. And the most prominent issue that were experienced by a lot of Filipinos, especially our frontliners, those who work in the hospitals, in the health sector, are discrimination. Yeah. So we would hear in social media, in the news, that there are nurses or health professionals that are not even being allowed to return to their homes, to their rented houses, or to return to their districts. There were even health professionals that were attacked on the streets because of a lot of fear and confusion from the public. All right. So these are just some examples of what has happened, wherein you can see one local government unit, their first COVID-19 positive patient who died. The death certificate was posted on their Facebook account, yeah, revealing all the personal data of that individual who already passed. And then of course, we have a lot of overseas Filipino workers who are returning from other countries because also of the pandemic issues. And then their personal data was loaded in a public Google Drive. Yeah, so anybody who wants to access can see all their names, addresses, contact numbers, their health status, their work history. Yeah. And then of course there are issues about the accuracy of the testing. So there was even one member of our Congress or Parliament who was announced as positive but turned out to be negative. So just imagine, the agony and, the despair, probably the individuals who would receive this news. So what can be done? Again, studying probably from the privacy statement of stay safe. I think the developers need to probably have to understand what data privacy and protection is about. For example, in the Stay Safe Privacy Policy Statement, they say that they follow the Data Privacy Act. So that's why they don't collect your real name and your real age. So you can actually upload health declaration anonymously. But at the same time, they collect your GPS and your Bluetooth locations, right? So we would all know, again, there must be some disconnect with regards to their understanding of what personally identifiable informations are. And then, of course, we would have read in the news that a proper privacy impact assessment should have been done on the contact tracing app so that they could have identified all the risks properly, especially since they promote the Stay Safe as an all-in-one app with multiple functionalities and various purposes outside of contact tracing. Yeah, and then they should probably take actions and embed very similar to Singapore and probably in what Titirat has mentioned to Thailand, embed privacy by design into the concept of developing the contact tracing app. And of course, review their processes and ensure that the way they have collected all this information can be checked for accuracy and relevance. And of course, I would probably suggest to the developers of contact tracing apps that they should always follow a life cycle approach. Though they may have identified risks at the beginning, once the app is already functioning and being used, and then they have to review it again, do some audit, and again review the processes. So with that, thank you very much for allowing me to share with you our experience in the Philippines with regards to contact tracing apps. Thank you.
Thank you very much, Edwin, for your insights on the Philippine applications and tools. And now we still have a very good amount of time left for the question and answer sessions. And what I'm going to do is that I am going to ask a question to each speaker first. And then if we have time, I will ask a common question that every speaker can answer. And then we'll take a couple of questions from the audience. So first, a question to Commissioner Libero. You mentioned in the strategy of the GPA task force is to do capacity building. So my question is that capacity building strategy is to improve the data protection authority side to understand the context better, or is that capacity building is to develop the people or citizens or both sides?
It's both sides. It's either side, Professor Ed. And the reason why we need to build new capacities or develop these new capacities, again, because we are being faced with such a very unfamiliar situation here. The pandemic itself, I mean, there's still no final answer on how to really curb or stop this pandemic. So we, and as the days were on, we continue to be faced with challenges as data protection authorities from, as I've mentioned, in the tracing, testing, and the treatment of patients. We are faced with a myriad of issues and challenges. So really, as you've mentioned, it goes both ways. We want to develop the capacity of data protection authorities during this time for them, and we've been comparing a lot of notes, and we're undergoing quite similar, very similar situations, and we are. And we all of us are, we all need the resources and references to help us navigate through this difficult time. That's why if you go to the GPA website, we've put up a resource library where we can, the GPAs can actually go over the materials and the new content that's being created to address this. And that's really also one of the objectives, to come up with a compendium of best practices from DPAs. So in the future, we can all, go back to all these resources and look at how the DPAs all over the globe have managed to navigate this very difficult moment.
Okay, thank you, Commissioner. My next question is to Professor Titirat. But I would also like you to present the rest of your presentation, like to give your views that you haven't mentioned in the presentation. But I also want to pose you a question as well. So I am a user of Thai Chana, and I noticed that, when I get into the app, they don't have a lot of information. Maybe we can say it's a privacy notice that they put on their screen or on the app. There's not a lot of information in there, but I think the important thing for citizens to know, because they want to know where their personal data is going. But then I think Thai Chana didn't give people enough knowledge and information to know where their personal data is going. Do you think that's one of the areas that Thai Chana app could develop to give more transparency about policy that they're doing on the data privacy to people more? Or are there other areas of development that Thai Chana app could take to be more data privacy friendly?
Thank you, Ed, for your questions. Yes, I do agree that information is the key here because the application itself is voluntary. And, of course, because you cannot force everyone to use this application, we do not have enough police power to force everyone to use the application to check in and check out, right? So it will, at the end of the day, become the voluntary effort by people who see the necessity of doing this and see the usefulness of using this app, and that can be collectively good for everyone in the society. So I think this kind of purpose is clear to people, but people are not very sure how their data will be used and how their data will be stored. So yes, information, more transparency will help people to feel more confident, to feel more comfortable to use this application. And also, I think for the privacy notice, there is one complicated area here because we have two different set of privacy notice. The first one is for the user, and the other one is the common individual user, and the other one is for the shops, for the restaurant users. And if you compare between the two privacy notice, they are quite different actually. So for the individual user, you will feel like the information will not be used for other than the disease control purpose. But for the restaurant and shops, you would see in the privacy notice that they might be used for the other purposes as well. And this might go outside the issue of data privacy per se, but it is also the issue about how the information collected, even though it is aggregated, like Commissioner said before, even though it is aggregated, it is still data generated by people, and it might be used for other purposes that is not related to health, to public health. And if we take into account another factor, that this app is operated by a commercial bank, then it raises an alarm for people, right? Even though the government might be with a true goodwill intention to protect the situation, and because we have limited capacity or limited expertise within the government, that's why we have to rely on the commercial bank to help this. But the explanation, the accountability is a key to prevent this kind of doubt, this kind of uncomfortableness of people who use this application. That is for Thai Chana. But for Mo Chana, which is another application that I said before, which use GPS and Bluetooth, I do agree with Kevin about the storage point of data. That because this application send data to the data center all the time, so it feels very not very safe for people who understand about how data works. And because it's voluntary in this sense, another solution might be to design the application, both the mobile and web application, to be user-friendly in the sense that user can feel comfortable to give out the information. And since this app will be, these apps are voluntary from the beginning, and if you cannot make the users feel comfortable to share that information, it cannot become 100% useful if people do not feel comfortable. Yeah.
Okay, thank you very much, Professor Titirat. And now a question to Kevin. Well, in Singapore case, you mentioned that there is now the intention to merge safe entry with trace together. If you have to guess, or you might already know, what would be the reason? Why does the government do this? I mean, is it out of convenience for citizens to, go to shops and then make everything combining together to make the tracing app the most convenient app that citizens can use, or are there other reasons behind this?
Right now, the most obvious one is convenience, right? From a rationale angle, as I said, you're now combining the ability to log the location where you go, right? And the people you mix with. So I guess someone made the very logical decision, why not put it into one single app, right? But when you do that, as I said, you're now opening up more permissions, and that now raises questions. So to quick answer, it is simply our convenience, and to me, totally not needed, because you can just turn your phone on your camera and go to the website, right? Why must you put it into the app?
Okay, right. Thanks, Kevin. Now, moving on to Edward. In Philippines case, there are a lot of apps out there that do this job. So I want to know what is the most popular app that people use, and do people use that app because they have confidence in the trust that their data is safe and protected in this app, or they use this app out of other reasons? So I just want to know if the people who are deciding to use the app, are they considering the data privacy factors at all in choosing what app they want to use?
Thank you for the question, Professor Ed. I think, again, since there are so many apps available in the Philippines, there's quite a fragmented in terms of the usage of this contact tracing app. Although one app, Stay Safe in particular, was adopted by the National Task Force as the official app, it has only reached 1 million users for the last 4 months based on their website. Yeah. So the thing is, again, the first slide that I shared, if you put that into context of the total population of the Philippines, which is at 108 million, so that's actually about 1%, yeah, who are using the Stay Safe contact tracing app. Now, if you put it in the context of the mobile devices that are connected to the internet, that's even less, right? Because we have about 175 million mobile devices connected to the internet as of now. So in that aspect, the probably effectiveness and the chance of being able to really do the proper contact tracing is very limited. And then I think one of the challenge also with regards to the Stay Safe contact tracing app is that it wanted to be an all-in-one, all-do-everything app. Yeah, it want to do contact tracing, it want to be a health declaration form, it want to be your health pass, it want to be a social distancing app as well. And again, there's so many confusions with regards to their privacy notice in their website, primarily because, again, they say that you can register anonymously. All we know that when you download the app into your mobile phone, then you're no longer anonymous, right? So your mobile phone is identified exactly. And then, of course, there are also some very broad statements in their privacy notice that they may opt to collect your device ID, your device operating systems, and of course, you have to turn on your camera to use the QR code. So there were also a lot of apprehensions from the public because, again, the app wanted to be a super, the super league of apps.
I see. Thank you very much, Edwin, for the answer. There are a few questions from the audience, and one of them is specific to Commissioner Libero. I would like to invite Commissioner Libero to answer the question. I don't know if you can see the question, but I can.
I'm still hearing it.
Yeah, I can read the question to you. I don't know if you'll be able to see the question. So the question is, are the rights of the public governments to know the COVID-19 status of individuals vis-a-vis privacy rights of an individual been tested in any legal jurisdiction? For example, would an individual be entitled to turn off their GPS or Bluetooth function in the app, such as those we have seen, and successfully claim the rights to privacy?
Thank you, Professor Ed, for that question, and to the person who posed that question, thank you very much. Let me just reply to you by saying this. As you have heard and as you have seen, ladies and gentlemen, There are so many permutations when it comes to contact tracing and other digital solutions that are being introduced to address or respond to COVID-19. But let us not forget that the most important thing here is that for these digital solutions to be successful. That's why, and Edwin will know this, and Mr. Kevin Shepherdson would also be aware of this. Since the pandemic started, the National Privacy Commission, the Philippines, we have actually issued 15 bulletins already to serve as guidelines and reference to everyone. And we came up with a particular bulletin on digital solutions, and especially contact tracing. And nowhere in my bulletin did I mention that companies must comply. What I only said there is that we are for the successful use of digital solutions during this time of the pandemic. And one thing that I'm very certain of is that for a digital solution to be successful, it must possess two attributes. It must be trusted and it must be inclusive, right? So, we have seen so many contact tracing applications and designs coming from programmers and developers who thought that their contact tracing app would be the silver bullet that could finally nail or clinch contact tracing. And not only the jurisdiction, of course, but probably even if it can be used worldwide. But still, I think at this point, we are still looking for, that contact tracing that could ultimately be tagged really as the solution to contact tracing. But we have not yet found that. And again, if you will just, again, as stated by our colleagues here in the panel, that the issues that are being raised also by citizens all over the globe are the same. It's about transparency and knowing if the application can be trusted. So really, the onus of presenting this to the public and for the public's uptake on this technology would actually, the onus will fall on the will be on the controller, the developer, on the developers who build the architecture, and supposedly they should have built the architecture with the information, with the proper use of the information, the proper processing, with data privacy in mind. So otherwise, whether it's Bluetooth, you use GPS, you use location tracking, ultimately the people will decide if it will be useful to them. And if they don't download it, then, again, we fail right at the get-go. It won't even reach first base. The app would be dead in the water right before it can even trace one contact. So, and this we should all keep in mind on how this application could be trusted, and how it could be inclusive, meaning the technology that will be used would actually include everyone, and we have to, and developers must consider that, because otherwise you can make the most advanced contact tracing application that can do everything, but if nobody downloads it, then it will be of no use to this campaign.
Okay,
thank you.
Thanks, Commissioner. My next question is also from audience, and I think it opens to all panelists to answer if you wish. Okay, so is there a regional approach within ASEAN to implement data tracing apps to contain COVID-19 pandemics? Has the region made any recommendations? Who would like to answer?
I'd like to contribute in answering that question. When Trace Together app was, let me reveal this, was introduced late February. Am I correct there, Kevin? Late February going to March this year. And I immediately got in touch with my counterpart, the Deputy Commissioner Z. Kane of the PDPC, and we started comparing notes. And during that time, we had still very early stages of the pandemic response here in the Philippines. And we also tried to come up with a Bluetooth application, this time on the side of government, just like what PDPC did. But yes, but here, as Edwin reported out, all right, the private sector initiative, right, really overtook what government was doing. But there's no problem with that. That shouldn't be a problem, right? In fact, it only shows how robust the digital community here is. And there are so many companies that have responded by developing their own app. What is premature actually is on how governments and private sector would work together in projects like this. And I think I'm not sure if this is also being manifested in some of the regions and even globally. And I really thought that after this pandemic, right, they should really open up the discussions or even come up with the new arrangements between private and public, and then government on how to collaborate and cooperate during times like this and coming up with very quick apps. Because I for one understand that the reason why private companies came out with these apps overnight is because yes, they really deployed all their programmers to work on this overnight and come up with what they thought would be a super app. Right. So anyway, going back to your question, that is really again I think a worthwhile mission that we can also explore, Dr. Ed, with Kevin here and with Thailand and the Philippines, of course, the ASEAN. But right now, I think the closest would be, again, this global initiative on the exposure notification API being distributed around the globe by Apple and Google. But nevertheless, this should not prevent us. Again, our economies are closely linked here in the ASEAN, and our data exchanges too are quite well, frequent and robust. And of course, we're neighbors. So these are the things that, again, moving forward, we should not, we should take this opportunity to explore this possibility.
Thank you very much, Commissioner. Yes, Professor Titirat.
I would like to just add one thing to Commissioner Liberal over there for the future, for the potential development in the future for ASEAN region. So one thing is that the deployment of this kind of app might also depend on the power of the government, how the government can access personal data. And I think we can see that in Asian region, and especially in ASEAN, each government has different power in getting this kind of information. For example, in Thailand, actually there were a project between the government, the Special Task Force, and the NBTC, National Broadcast and Telecommunication Commission, that they might want to get some information from the telecommunication service provider, the mobile service provider, to get the locations, plus those potential mobile users who were in the risky area. So in this sense, if the government used this kind of method to get the information, some might say that the government does not need to use this kind of web contract tracing application at all. So the contract tracing will be something complementary to the government power. But of course, in some other country, these kind of governmental access to personal data in private sector will be totally prohibited under the constitution or under the data protection law. So I think these might be another concerns when we try to think about regional recommendation.
Thank you, Professor Titirat. I think that's all we have time for, because I was told that the system would cut off at 5 p.m. Thailand's time. Such a shame that we have to continue. I mean, we have a lot to continue later after this, but I would like to thank every speaker who's here today at this webinar. We have a lot of insightful information, and we hope that this dialogue will improve and be developed into further use of the society and the global initiatives. So thank you, and thank you the IIC for making this initiative and webinar happen. So again, sincere thank you to everyone here.
Thank you.